going to turn my recording on.
Yeah.
Good morning. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So good morning. So we are in the middle of National Public Health Week. For 25 years, the United States has observed National Public Health Week as a time to recognize the contributions of public health and highlight issues that are important to improving the health of our nation. Right now, more than ever, the importance of a strong, effective, and well-resourced public health system has been on full display during the COVID-19 pandemic response. We are here to serve. Every day in communities across Cuyahoga County, across Ohio, and throughout the entire country, local and state health departments are working to create conditions in which everyone has a fair opportunity to be healthy, everyone. We vaccinate your children and parents and grandparents against once devastating diseases. We visit moms and newborn babies to keep them safe and healthy. We support children with medical handicaps and work to prevent infant mortality and racial disparities and inequities in our communities. We coordinate the support for people living with HIV and AIDS in Northeast Ohio, and we prevent opioid overdoses. We protect the food supply in grocery stores and restaurants. We analyze community data for critical public health decision making. We promote healthy eating, active living, and reduce tobacco use. We promote health equity and fight for those in our community who face the compounding disadvantages associated with racial inequities and poverty. And as you're seeing in real time, we evaluate, respond, and control the spread of illness in public health emergencies like COVID-19. We do these things and much more. Please go to ccbh.net, our website, learn more about how we keep you and your loved ones healthy in ways that often aren't visible to society. I want to thank all of our wonderful staff here at the Cuyahoga County Board of Health and our partners and my friends across Ohio who I've known for 30 years. Public health warriors, one and all. So there's some new data that Kevin's going to show, Kevin Brennan, our communications officer, that we picked up from Google. And so he's going to present it up on the screen. If you'd like to give time to shift, we'll let you do that. So Google's launched a new website that uses anonymous local data collected from users of Google products and services to show the level of social distancing taking place in various locations. The COVID-19 Community Mobility Reports website will show population data trends in 6 categories: retail and recreation, grocery and pharmacy, parks, transits, workplaces, and residences. And what you see is, I think, some very promising data that tells us that Ohioans and Cuyahoga County residents are staying put. They're staying put. And we are seeing the models that we'll talk about in a bit, and we've been hearing more about in the press, are indicating that Ohio is flattening, significantly flattening the curve because of these things. And Cuyahoga County residents are a big part of that. But the message here is that we cannot relax on this. We need to continue to follow the Ohio plan. The data will check changes over the course of several weeks, and as recent as 48 to 72 hours prior. It will initially cover 131 countries as well as individual counties within certain states. Google says the data will be collected in aggregate rather than at individual level and won't show absolute numbers of people showing up at parks and grocery stores. It's outlining percentages which highlight potential surges in attendance. So we're going to use these data along with the data that we collect from hospitals, along with our public health data on cases and contacts that we're tracking. A whole range of data come together to help us understand at a very granular level the situational awareness in our community. But let's be clear that we need to continue to stay the course. We need to continue to follow the Ohio plan. It's working. And so every time you stay home, every time you work remotely, every time a business decides to close in support of their community, every time somebody washes their hands, like their grandmother said, every time surfaces are cleaned in commonly used areas, every time people stand back and give space in grocery lines and in stores, you're saving a life. You're preventing someone from becoming ill. Every one of those interactions, and you're part of it. And so we appreciate your participation and thank you for being part of the solution. But let's continue this. I know the weather is getting warm and people are getting a bit antsy, getting some cabin fever. But we need to stay and avoid those interactions because we can see in real time the benefits of what we're doing and the lives that are being saved. It translates into real people, people we know and people we don't know, people we care about, and the people in the community that often are invisible and ignored that we're here to support. So there are some recent reports around closure of local business that you heard about. We've had our first instance where a business was closed based on a state order regarding whether the business was essential or non-essential. So there is now a review board at the state level where there may be differences of opinion about whether an agency should stay open, whether they're essential. And Common Pleas Judge Brendan Sheehan granted a temporary restraining order closing a business, determining that by staying open, the business created an unnecessary risk of spreading COVID-19. Please understand that our intention is not to take any one business or owner. This is about the collective. So if people are gathering in a store, think of a scenario. People are gathering in a store and congregating. They may unknowingly be spreading COVID-19 to people in that store who could go back in their communities, back to their families, back to their workplaces, and then ignite chains of transmission, perpetuating cases and potential fatalities. So these things are interrelated. And so these steps that are taken to protect the public's health are working, and we support them, and we appreciate the cooperation with the business. It's our intent to protect the spirit of the order, which is rooted in trying to get people to stay home and not congregate. We're doing this because it's working. Each day we get more information and greater clarification on the extent of these orders. We have 88 counties in Ohio, and we're doing the best we can, dealing with hundreds and hundreds of calls on a daily basis in our call center, try and work through these issues around essential services. And our folks are working hard every day to try and err on the side of caution, and we appreciate businesses doing the same thing. This is a huge disruption, and we appreciate their support for the public health of our community. So we're seeing discussion about more and more people when they're out in public places wearing masks. Here at the Board of Health, all the staff will be wearing in public. We have guidance now we're developing around cloth masks for our staff in public, and that is a step that we're taking. We don't want to use surgical masks and N95s because they need to be left for EMS. They need to be made available for our hospital workers, other healthcare workers, long-term care facilities that need them most. And so we're starting to see more and more people wear them. If you've been out at grocery stores and in the community, you'll notice that. And so it is our intent to remind people that this is not a substitute for social distancing, that these cloth masks are meant to protect us from potentially exposing others unknowingly, and that social distancing in coordination with the whole range of these things that we're doing now around preventing mass gatherings and remote work, etc., all work in concert. Not one thing, but all these things together work to prevent cases of COVID-19 and fatalities. So it's important, I think, that people recognize this as we work through these issues. So I think in wrapping up, we are encouraged by what we're seeing here in Ohio. We are encouraged by the fact that we are flattening the curve substantially. But that encouragement needs to strengthen our resolve to follow the Ohio plan, because that will be our way to demonstrating to the nation that Ohio did things right, that Governor DeWine and Dr. Acton led us down the right path, and we know that to be true. So with that, I would like to hand things over to Dr. Gully.
Thank you, Terry. Good morning. Thank you all for being here and for continuing to provide important information to the community as this continues to evolve. I'd like to start this morning by thanking a few groups that I haven't yet mentioned. I'd like to thank all of our staff in the correctional facilities in our community and also across our state and our region. Those folks work really hard in their regular jobs to ensure that people who are in our correctional facilities are cared for, but also I want to recognize that this presents also a risk to them as well, just as it does to our first responders and our hospital staff and all of the other essential employees in lots of different sectors that are working. And so we want to thank you for your service. We want to thank you for all the work that you've been doing, and I can tell you that in our community we have these proactive plans that have been in place for quite some time, and we had lots of discussion prior to there being any cases in any correctional facilities about how to keep everyone safe. And I think that you're seeing prevention in action in those facilities, and I just really wanted to recognize all the staff who are working so hard to make sure that everyone that's in those buildings is safe. I'd also like to recognize all of our social service partners. I feel that I wish I could name every social service partner that's working extra hard and a lot of extra time right now to make sure everyone in our community has the services and supports they need that maybe they didn't need before this started. So many people are out of work or they're needing supports they haven't in the past, and our social service agencies are stepping up and really working hard to make sure everyone has what they need. Lots of people in child and family services, people providing frontline nutritional support, lots of people working in domestic violence and resources there, a lot of our behavioral health colleagues. So I just want to thank you all. I wish I could name you all individually, but please know that those of us here at the Board of Health, we see you, we really appreciate you, we're your partner in this, and please let us know how we can help you continue to do your work better. The National Public Health Week theme, and picking up on where Terry left off talking about the National Public Health Week, we don't normally get to talk about National Public Health Week in front of media as robustly as we are now with this pandemic, but it's important that we take that opportunity to highlight the messages that our national public health organizations have set forth. Those were designed before the pandemic of COVID-19 came about, but they're very important in this pandemic and also outside of it. The theme for this week is violence prevention, and we want to let people know how important this is all the time, but particularly during this pandemic when stress levels are high and we're seeing increased reports of domestic violence incidents. We want people to know that the Domestic Violence and Child Advocacy Center works 24/7 to support those families and individuals who are victims of domestic violence, who are survivors of domestic violence, and who need help in the moment and on into the future. The center envisions a community in which all people enjoy lives free from violence and abuse, and they feel safe and secure in their relationships. They are here to help around the clock, and they can be reached at 216-391-HELP. Thank you for all you do for our community, and we really want to continue to partner with you now and on to the future. So as I do every day when I present data, I'll remind you that I'll present more robust data on Friday, and we are doing a lot of analysis this week to better understand our race and ethnicity data, the completeness of that, and also the breakdowns of that, so that we can help highlight issues around inequities and disparities. So more information will be forthcoming with the additional robust data that we provide on Fridays. But with the data I present on Mondays and Wednesdays, I want to again remind you that every person represented in these data is a critically important, invaluable member of our community who has been really affected by this virus. Today's lab-confirmed cases for the Cuyahoga County Board of Health jurisdiction are 647. The age range of those cases remains at 1 week of age to 101 years of age. And the range of illness onset dates is February 29th to April 4th. We now have 20 deaths in our jurisdiction, and the age of those deaths, the range, is 55 to 93. The range of death dates is March 20th to April 7th. I'd like to then also now move on to talking a little bit about models. So when we present these data to you Monday, Wednesday, and then on Friday when we present our epi curve as well as our map and now other demographic data, that's all epidemiologic data that's been collected in the past. And so what we try to do with those data is really understand what's happening in real time, and we try to analyze those as quickly as we can to understand what's happening and how much more we need to do. And are public health interventions working? Where is our hospital surge capacity? All those things are things we're doing in the moment. But there's another piece of data, which is taking all of that and fitting it into mathematical models, computerized models, to understand the future. And that's really important in this pandemic for so many reasons. We'd all love to get back to our lives as soon as possible. We'd love our economy to be back to where it was. People long to get back to work, right? But we don't know exactly when it's safe to do that. And so you're seeing a lot of models presented, either at the state level, now at the local level, or nationally or internationally. And those are trying to help us understand the situation and the timeline. But every future prediction can only be made with some assumptions, some things built into that mathematical model that help us understand what might happen in the future. So all of these models have limitations, but we're trying to understand them to best give you information about how long is this going to be? How long do these public health measures need to happen? And so we'll continue to help you understand those as they evolve. But it's really important to understand that those models all take into account what's already happening with social distancing, staying at home, all the public health measures we're doing in terms of case identification, isolation, contact tracing, quarantine. So all of those things in those models say that we're going to continue to do this for now. And so we don't want people to see those models and think this is going to be over in a week or 2 or 3 or 2 months or whatever model you saw. And that means I can sort of let up, not wear my cloth mask, go out, start having parties at my home, etc. Please, please, please adhere to the social distancing, the stay-at-home orders. Every single act you take as an individual is saving somebody else from getting infected now. And that could be your family, it could be your friend, it could be your neighbor, it could be a stranger. So please don't let up. Please stay adherent to these recommendations. We too would love everything to come back to normal as soon as possible. But if we do that too quickly, we will have a resurgence of infections, and we can't afford that for anyone in our community. So we want to leave you this morning with just that notice that yes, we're really trying to understand our data. We're trying to understand these models. But more importantly, we want you to hear that everything you're doing is working in this community and across the state of Ohio, and we can't let up. We will let you know when it's safe to do so, and we're following the Ohio playbook, and I know our state officials are eager to help all of us understand that timeline, but the time is not yet now to pull back on those measures. So with that, we will take some questions. Arlene.
Good morning, Dr. Glenn.
Good morning.
I appreciate your comments on the models, everything, because as you just said, there's a bunch of them out there now, which can lead to some confusion for people. And as you know, Metro Health came out with another model yesterday, which basically said we're not going to see a big surge, there'll be more clusters. But what do you think of that particular one?
Great. So the question is, what do I think about the model that our Metro Health partners released yesterday that talks not about a big surge and a big top of the curve, but about clusters and a longer, more ongoing cases sort of percolating for a long period of time rather than a big surge. I would say that that model is helpful for a lot of reasons. You've all heard me talk at nearly every press conference for the last few weeks about clusters. What clusters are is anytime we identify a case, and this is why our case identification and isolation are so important. We've done nearly 600 case interviews with lab-confirmed cases, and those folks help us understand the pattern of their movement, their work exposures, their personal exposures, and then we talk to their contacts, and that helps us identify clusters where we know that people have been exposed and then become sick. And so that is consistent with what we're seeing across the community, that there are clusters of people who are positive and we can trace them to each other. And so that's definitely something that we know is happening, and our team here is very aggressive about understanding those and isolating and quarantining people related to those clusters to try to prevent the combination of clusters from coming together and creating a big surge. But we also know that without enough testing, we're probably not understanding the full extent of the infection in the community. And that includes probably other clusters that exist that we can't get those people tested. So I do think there's definitely some high value to that model, and we're very appreciative to Dr. Boutros for sharing it with the community. But it's one model that tells the story of what we're seeing, but other models are also helping us understand from different angles.
So when do you think we will see the top of the curve here in our area? Because there's different models are saying different things. What's your thoughts on that?
Yeah, so the question is, when do I personally think we're going to see the top of the curve? I really don't know. I wish I did. I was asked that question yesterday with a group of colleagues on the phone, and one of our colleagues, epidemiologist, doctorate level epidemiologist, is working really hard to understand all the assumptions in the models so that we can better articulate or communicate to the public about which model we think best represents our local context the best. But I don't think it's going to be a clear answer. I think that this continues to evolve. Without testing, we're really not able to adequately understand the different pathways of transmission. The other thing I'll say is that clusters are very helpful to understand, but there's a lot of community spread happening where there's no clear exposure to somebody else. So clusters help us, but there's a high degree of community spread where we don't know where someone got it. They got it probably out and about at the store or something like that. So that's also important to consider when you think about the top of the curve, whether we have a big surge or several big surges or a slow percolating infections over months. Either way, we know there's both cluster spread and community spread.
Is there anything new on testing in terms of an increase locally?
So the question is there anything new on testing locally? No. I will certainly be very excited to share with you the morning I find out. I might call a press conference when there isn't one if we get testing. But no, and I remained absolutely determined to figure that out. I don't know where the funding or where the resources are going to come from. Our hospital partners, we continue to work with them to try to increase the public health side of the testing, but broad-based community testing is essential for us as we work through this over the next few months. And so as soon as we know how and when that's coming, we will communicate it with you, because we and our team here are eager for that to happen so we can best serve our community in this response.
I had a couple questions for Terry about the consignment store situation. So I'm wondering a little bit about what the Board of Health's interaction with the consignment store was leading up to you guys seeking this order through the courts. And I'm also wondering, are you seeing, you're working with these businesses and talking to them before you're escalating it to that level. Are you having back and forth conversations with other stores that seem to be pushing back against your guys' recommendations? And are you preparing to file other restraining orders for other businesses in Cuyahoga County?
Right, I guess according to the best way to, so the question is, the consignment store in question where there was an order, restraining order on operation. What was the interaction like with the health department leading up to the order? Are there others that you're working with in the community? What is this general status? So I think that's the general question. So I would say that we have been, along with our business community, learning together about the what the guidance from the state and the governor's orders mean. And so that has required a lot of granular related work to make these individual assessments and to talk with our legal counsel and our partners across the state. We have an ongoing relationship with health departments across Ohio, and so we've had conversations with our colleagues at the Ohio Department of Health and across this region where we have a business or a line of business, and making determinations on whether or not they're considered essential. And so 88 counties means all of us are taking a look at this, trying to use the best information we have, and there are going to be inevitably some differences of opinion. And so I think that's the idea of now having this statewide board to make that determination. So in every case, we are, dispassionately making assessments with businesses. And I think people are sincere about their reasons for feeling that they qualify. And in the same way that we're sincere about trying to work through the governor's order with the real goal of getting folks, to the degree possible, to err on the side of caution and to not allow spaces, if it's not essential, to not allow spaces where people can congregate for the reasons that we described earlier. So my sense is that, the hundreds and hundreds and hundreds of calls that we're getting on a daily basis are sometimes people from businesses that are asking about whether they're essential. Sometimes they are employees that are asking, should this business be open? And so we're seeing now that I believe people are trying to do the right thing. I think that is a default for our community. But where there are differences of opinion and where those differences are sustained, we will seek legal support to make the right decisions to err on the side of caution. But I wouldn't expect this to be the last one, potentially. I think people will learn, and when you have decisions from the state board that will be looking at these differences, and when you have rulings at the county level, they will influence policy at the state level and create clarity that we're all seeking, even as we don't have perfect clarity in the guidance from the state. So this is it's an evolving process, and there will be some ambiguity, and we're comfortable with that. We have to be comfortable with that, whether it's here in Cuyahoga or it's in Lake or it's downstate in Meigs County. We are all working through these issues, and we're committed to do that. But I would expect it's possible we would have future rulings. I wouldn't say that people are outwardly sort of thwarting the law. I would say that they may have a difference of opinion about their interpretation, and I think that's sincere, and we're okay with that.
So Metro Health's model had kind of those waves. It's kind of different than the more traditional models that we've been seeing. I know you don't know exactly what things are going to look like in the future, but is there a way to kind of lean one way or the other toward what you're expecting here in Northeast Ohio? Should we prepare more for the Metro Health model or more for some of those more traditional kind of bell curve models?
So Scott's question is the Metro Health model has some up and down over a longer period of time as opposed to some of the other models that have the big epi curve that reaches a peak and then flattens out. And what do we think here locally about those two models and which one should we prepare for? And I would say both. I think that there is a lot of merit to understanding both models and how each of those groups of modelers have come to those results, and that's also part of understanding the assumptions behind those models and why our team is working so closely with our hospital partners who all are working on modeling as well, in addition to our own team here, to understand what those assumptions are and how they apply to our local community. Again, remember, our community is not just the residents who live here and work here, but it's also the people who seek hospital care here. And so we have some assumptions here that we need to think about, which may not apply to some other counties that have fewer hospitals, or their hospitals aren't the tertiary and quaternary care centers that we have here, where people come in to have high level intensive care unit support. So for us, I think that this is not going to be a big surge and then over. Okay, I think for our community, and again, this is just based on my understanding and our team's understanding, that there's probably something in between both models that applies to our community. And it is possible that there are multiple surges at some point over time, particularly if people do not heed stay-at-home warnings and they don't practice social distancing and they go out and begin to do things and gather in groups in a premature way. That's certainly there. These models depend on those public health, we call mitigation efforts, those community-wide efforts, to be intact. And if those are not intact, we will see more, right? But we also know that these clusters are also driving some of that. So I suspect that it will be a combination of the two. But again, we're continuing to learn, and this is evolving. And so we'll continue to help the local community understand these models as we understand them better as well.
Does that mean people should prepare for kind of a longer stay-at-home period than maybe initially thought?
The question is, should people prepare for a longer stay-at-home period than we thought? We are following the governor and Dr. Acton's orders on those, and I think that they have access to the best world-renowned modelers trying to apply understanding to the state of Ohio, and then we're trying to apply understanding to our Northeast Ohio region. So I think in concert with our state partners, we can provide further guidance about that, but I would tell people that this is not where you think life will return to normal as you knew it 6 weeks ago or 8 weeks ago quickly. And I would love to be able to give you a date or a very specified timeline, but I think that would be reckless and not appropriate right now, given the constantly evolving nature of this and the fact that we don't have widespread testing. I know I continue to come back to that narrative, but that is really important because if we don't understand how much infection's in the community right now, it's really hard for us to give a timeline prediction on when we can begin to pull back these mitigation efforts. So this is about balancing safety and transmission of this virus and minimizing loss of life with returning to the economic vitality that our community needs and to life as we all know it as individuals and as neighbors. And that's a tension that none of us ever wanted to have to grapple with, but it's one that we feel that we're going to continue to do using evidence and data.
I have a question about health disparities. Oh, I'm sorry.
No, I appreciate it, but thank you.
I know you said that you're collecting more data and that you'll have more to say on Friday. But I'm wondering what you're thinking about what you're seeing in other cities because Cleveland is not unlike some of the other large metros where we've seen some data come out about African American community in particular being affected. What do you think about what you're seeing in other large metros and what we might expect here?
So Marlene's question is, what do I think about what I'm seeing in other large metropolitan areas that have a racial and ethnic demographic breakdown that is similar to our community here in Greater Cleveland? So from the very beginning of this pandemic, we have been collecting robust data. All of the things that we collect when we do case interviews are included in a form from the Centers for Disease Control as well as the Ohio Department of Health, and we've made all of those forms available on our website so that you can see what data we're collecting. We've been aggressive about collecting race and ethnicity data among other types of data because in our community we know that there has been a historical, very unfortunate legacy of racism, of structural racism, and of our communities of color having an experience quite different from others. And that has led to differences in life expectancy before this pandemic. It has led to differences in the burden of chronic disease and other issues. And those disparities and those inequities carry into a pandemic. Anytime there's an emerging infectious disease, there are always populations who are most vulnerable. And those populations tend to be populations who have been subjected to injustices over a long period of time. And we know that this virus affects everyone, but people who have chronic diseases and people who have issues with their health are at higher risk for dying from this disease and also having complications from this disease. And so we know certain communities have higher proportions of differences in health. And so we're going to dive into that and provide a lot more context for you on Friday. I want to ensure that all viewers understand this issue very deeply, but I think what we're seeing in other communities is what we've been describing here in Greater Cleveland, for the last few years around the impact of redlining, of structural racism, of implicit bias, all affecting our communities of color in unjust and unacceptable ways. And so we commit to you here at the Board of Health that we will do everything we possibly can on the public health side and in conjunction with our hospital partners to ensure everyone in this community has the opportunity to survive this pandemic, and then on the back end of this, to continue to address the inequities that existed in our community due to race and racism prior to this pandemic. And I know other communities and our public health partners across the country and in other parts of Ohio are also in that work before this pandemic, but I think you're seeing this play out with the pandemic layered on those inequities. And we've got to have a conversation, a very honest conversation about that, continuing in this community, but as a nation as well.
I think one more question.
Yeah, just for Director, although Dr. you're welcome to answer it as well. Regarding that chart that Kevin had pulled up, we saw retail recreation was down, but apparently like parks were up. If you can interpret that, first of all, what's the baseline? Who is that being compared against? I know it's the county. Is it statewide, or is it, I know it's Google data.
Yeah.
And then what does that mean with the pluses? I'm assuming that means that those are areas that we are not doing as well.
We'd have to pull the model back up if we could, please. Thank you. All right, so the model up there shows in some cases, remember, as you say, Vic, this is Google data. So we use this as one of the many pieces of information on a dashboard of data, whether it's our information on our cases and our contacts, information on hospital systems, a range of indicators that help us understand in conjunction with our state partners what's happening. So we think it's another interesting data point that we'll take into account. So if we see minuses, we're seeing the number of people that are sort of congregating in places like retail and grocery stores, that seems to be down compared to baseline. People may be in parks. We think it's okay if they're in parks as long as they are social distancing. So physical activity is good. Let's do it safely. Let's create some distance. If you walk around your neighborhoods, and many of us were out seeing the supermoon last night. I know I was. It was a beautiful night. But I saw people taking great steps to be distanced from each other. Even as they were admiring the moon, it was beautiful last night. And it was a beautiful night for weather and to get out and to get some exercise. But use of parks is good because people are sort of cooped up inside, but creating that distance is really critical. So you have to bear that in mind when you look at the data. I think transit relates back to people going to work, back and forth. And so workplace as well. And people are hanging out at home more when you look at the residential data. I think that that's also good. There's some data from the New York Times that Dr. Gullett and I had talked about earlier, where based on some use of Wi-Fi, indications that the Midwest, I think the caption from the Times was that the Great Lakes states are crushing it on flattening the curve, not just flattening it, but crushing it. And that's, again, we are heartened by that. But it does not mean we should pack up and dust our hands off and say we've completed the job. We have great faith in the leadership of the governor and Dr. Acton across the state. And if we follow that, we can all take pride. And at the end of the day, using data like this to help us understand where we are and where Cuyahoga County stands, and these data are available across the state and across the country. I think, frankly, across the world, there's data made available through a range of sites and a range of those processing these types of data. But we take all these together, and including the range of models that Dr. Gullett discussed, and we try to basically determine if there are any themes. And the theme here is that Ohio is doing the right things, that Ohio is providing leadership for, I think, the nation. And what we have here in the takeaway messages, I personally don't think will be the same at the end of this. I know that in 30 years in public health, I've never seen anything like this. Having lived through anthrax and smallpox after 9/11 in our response, H1N1 in 2009, Ebola in 2014, I've never seen anything like this. And so I don't think we should be the same. that we've all been touched by this, personally, professionally. We've seen a lot of heartbreak in the past few weeks. I've also seen some incredible breakthroughs and some incredible heroism in our staff. And I don't think we'll be the same, but we'll be better for it. And we'll remember what public health is for in this community and why it matters. And so that I am heartened by. So with that, I think we're going to wrap up as our last question. We appreciate, as always, your time with us today, and be safe, please, with your families. Thanks.
And Director, just real quick, that's the 87 other counties as the baseline, or is it the country?
I have to check. Vic, I have to go back to the data to check. I
No
don't
worries,
have an
yeah.
answer for you right
Yeah,
now.
but I understand the baseline.
Right, the baseline.
Compared against Ohio.
I'll go back to the Google site, and we'll let you know on Friday. How's that? All right, thank you, thank you.
Thank you all. There's semi-healthy oatmeal over here. Cookies for you. Have a good one.